Here at Kellerman Dental, we take a lot of pride in offering our patients the latest in technology. The reason we make such a big commitment to invest in this technology is because we want to provide the highest standard of care as well as provide the safest treatment possible for our patients. One of the first items of technology that we've invested in is digital radiography. Digital radiography is advantageous because it provides a lower dose of radiation to our patients, and it's more efficient because it provides an instant image rather than waiting for 5 to 10 minutes for a conventional x-ray to develop. And it's also more eco-friendly since we don't have to deal with the chemicals of the x-ray processing unit. On a 2D digital image, other advantages include being able to manipulate the size of the image as well as the color and contrast of the image. This allows us to see different areas of the tooth in different ways, therefore allows us to give a more accurate and thorough diagnosis based on what we see on the image. As you can see, I can use a spotlight, and the spotlight helps me look for cavities that are going on in between the teeth, and I can also magnify the image where another window pops up and allows me to zoom in on a particular part of the tooth. This is very helpful, as many times the patient can also see for themselves what is going on with the tooth, and it helps with co-diagnosis along with the patient. And I think patients really appreciate that. Other technology we've recently invested in is our cone beam 3D X-ray, which is right here. The advantages of a cone beam 3D X-ray is that instead of a 2D image, it gives us a 3D image. And it's essentially a CAT scan for dentistry. With this 3D image, we can more accurately and precisely plan and treat teeth that may require extraction, root canals, orthodontics, and implant placement. I'll show you an example. This patient was interested in a dental implant due to some missing teeth in the posterior area of her lower jaw. Because we took a 3D image, I could very accurately and precisely measure the amount of bone that was around her teeth. I could see where the nerve of the jaw was, therefore planning to avoid the nerve. And I could choose the proper size implant based on the measurements I took from our cone beam 3D X-ray. Again, this allows for more accurate and precise implant placement, therefore making the procedure much more predictable and safe. After we placed the implant, I took a post-operative X-ray which showed me the placement of the implant in the bone, and I could verify, and the patient could verify with me, that the implant was totally surrounded by bone, therefore making this surgery a success and ensuring a very high chance of long-term success and comfort for the patient. Thank you for listening to my little explanation of our technology that we have here at Kellerman Dental, and we look forward to serving you.
And I'm going to show you how to use the cone beam machine today, and we're also going to demonstrate how easy and comfortable it is for the patient to be in it also.
Okay, Sam, if you just want to step around the back here. And this is pretty simple. I'll explain what we're going to do. I'm going to have you bite down on this right here. There's a little lip right here. You're going to butt your front teeth right against there. And I'm going to open this, and these will rest on your temples. Perfect. I'm going to let that release. I'll take your hands, please. Go here. I'm just going to verify to make sure that we have it set up for the right tooth. I use this little card to check my laser. So we're doing the upper right today. Perfect. Okay, and just stand still for me. I'm going to push a button. I'll let you know when we can release. Okay, I'm going to put these like this. Go ahead and step back. And that's exactly how. So this is the image that we just captured of Sam's tooth. We can manipulate this And Dr. Coleman can view the number of roots, the curvature of the roots, as well as the length of the roots.